Hey guys, a lot of news breaking, and I don't have my stuff with me, my computer or anything. Oop, that's my finger. But the new Republican healthcare bill came out, and there's a lot to digest about that. So immediately, the first thing is that we have to realize that this isn't a healthcare bill. We have to, if we're going to talk about it, we have to realize that this is a tax cut for the wealthy, rich top 0.1% of America. This is nothing more than just a tax cut for the rich, and there's no other thing in there. So the bill basically, some of the biggest parts are you get a tax credit now. Oh wow, thanks for the tax credit. So basically, they're going to come up with a sum of money, a tax credit that you get subsidized by the government. But any if you have any procedure that costs more than that tax credit, you have to pay out of pocket immediately. So it doesn't cover you with anything. You basically, what this healthcare bill is allowing Republicans to do is they're going to go, okay, so first of all, Obamacare, it's not about that health insurance. We're not upset about the health insurance part of Obamacare, because who would be upset about 20 million people, up to roughly 30 million people, depending on which source you look at. But definitely, even Republicans are like 20 million people. Yeah, that's definitely the minimum. 20 million people getting health insurance. I don't think anybody's really against that. I think that works. I think it shows that Obamacare worked a lot. But they're like, it's not about that. We were never really about that. What we were really about is the top 1% having to pay more in taxes than to supply people at the bottom who are using that money to get health insurance. So basically, I'm going off the cuff, by the way. I'm just trying to get my point across and trying to explain the bill, which I've read part of it, by the way. So basically, what happens is for the middle class, you get no tax cuts. There's zero tax cuts in the bill that are for the middle class. The top 1%, though, do get a tax cut. So if you look at the numbers, on average, under Obamacare, the top 10% of people, so like the richest of the rich, lost 0.3% of their income due to taxes to help support Obamacare and what it was trying to do. Okay. On average, the top 10% of Americans, so the wealthiest of the wealthy, make on average $4 million a year. If you do the numbers, 0.3% of $4 million is $12,000. You're still making 3.88. That's not even correct, I don't even think. 3 million, I don't even know, but you're still making, I think taking $12,000 in taxes to go through the federal government to pay for Obamacare isn't that bad, because you're still doing well off. So Republicans are like, 0.3% of my going to taxes, that's too much. We can't. And it's not even like Republican voters. That's the thing. It's the Republican establishment. It's the lobbyists. It's the corporations. It's the health insurance agencies saying, we don't like this. It's the wealthiest Americans saying, $12,000, I can't live without $12,000. Chemotherapy on average costs $10,000. Okay? So to put that in perspective. So this isn't a healthcare bill that they're trying to pass through. It's a healthcare bill in name only. That's it. That's the only reason. That's the only thing about it, is that it's not a healthcare bill. It's a tax cut disguised as a healthcare bill. I can't get over it. And then another thing. Apparently they went through the House last night. Just in the dead of night, they passed it in the House. Obamacare was enacted or written and recommended in 2009. You know what that means? It wasn't passed until 2010. There were debates endless debates in both the House and the Senate that went on for months about Obamacare. And Republicans are like, shh, 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 all right, pass in the House. Okay, now we just got to get in the Senate. Hopefully, Senate Republicans who are very far to the right and would almost go to anarcho, free capitalism, let the corporations do their thing because we trust the corporations to do whatever they want and actually give health insurance to the people and not try to make a profit, which is a profit incentive to turn people away to make more of a profit for these rich corporations. So hopefully people on the far right who says, no, we need a repeal. This isn't a repeal. This is Obamacare light. And people like libertarian Republicans like Rand Paul can go up there and go, this isn't the plan I want. We need to do my plan. And Rand Paul's plan still sucks, but it isn't the garbage that is this plan. Hopefully Republicans who are very far to the right and people like Rand Paul can go up and go, no, we don't want this. And hopefully Republicans in states that expanded Medicaid, or is it Medicare? Medicare, Medicaid? I think Medicare. Expanded the Medicare expansion under Obamacare, which is something Trump said in his speech. He was like, we're going to expand Medicare. Obama had a specific article in its bill that expanded the Medicaid. And you know what states rejected the Medicaid expansion? Southern Republican-held states. The hypocrisy is just amazing. It's amazing, the hypocrisy. So, Trump goes, Medicaid expansion, amazing. Obama tries to do it. They try to filibuster him. They break the filibuster record. The Senate has never used the filibuster as much as it did under the Republican-held Senate in the last 6 years. And they try to repeal it 60 plus times, even when they didn't have a majority in the House or the Senate. And even if they did, Obama would veto their repeal. So they don't care about you. I get it. Democrats can be extreme, and it's super easy to make fun of a democratic ideal. Okay, so you're just going to take everyone's money and you're going to pay for people who don't deserve to get health insurance to have health insurance. Yes. I'm not. When Bernie Sanders goes out there and goes, healthcare is a right, not a privilege. He's correct. Having healthcare isn't a privilege, it's a right. And then during one of the debates during Fox News, what's his name? Chris Wallace asked him, what makes healthcare a right and not a privilege? What makes healthcare a right and not a privilege? And he goes, being a human being. You deserve healthcare. Yeah. So, look, I get it. Single payer, your taxes do go up, but you're not paying for deductibles or premiums because it's only one. You get it from the government. You get sick help. Not sick. You have the ability to go out and search for a doctor, but it's going to cost you money out of pocket. That's what the Republican plan is. Paul Ryan said it in his speech, in his presentation on the AHCA, the American Health Care Act or something, which is what the Republicans are calling it. It's not, just call it Trumpcare, it's Trumpcare. If you want to call it Obamacare, fine, you can call it Trumpcare. What was I saying? I don't remember what I was saying. Oh, okay. The ability to have a free market is not the same as being covered. The ability to go out and search for a doctor is not the ability to have a doctor. You can go out and search for a doctor, but it may be too expensive. So there's a difference, but he said it, and I tweeted it out. Follow me at Twitter at politic jargon. I couldn't fit political jargon, or was taken, or one or the other. So politic jargon. So yeah, there's a lot wrong with this bill. There's a shit ton wrong with this bill, actually. It's not even a healthcare bill. It's a tax cut disguised as a healthcare bill. I don't like it. Everyone should be opposed to this. Everybody on both sides of the issue should hate this bill. So I get it. One final point, I get it. Single payer sounds like a drag. Single payer sounds horrible. Okay? When Ted Cruz and Bernie Sanders had their debate, Bernie Sanders whacked Ted Cruz silly. But the problem with it is that people walked away going, oh, Cruz won because he just lied out of his asshole. He was spewing fucking diarrhea of the mouth. It was disgusting. Two of my biggest arguments, two of my biggest problems with Ted Cruz during that debate was waiting lines. Okay, those are for elective procedures. Elective procedures, meaning if you are electing to do this and you don't need it to stay alive, yes, you're going to have waiting times, because for single payer, how they do it over there in Europe and how I would want to do it over here is you prioritize based on need. And then people after were saying, okay, Ted Cruz also went out there and said, oh, they prioritize, or something. It was something to the effect of they prioritize. And your response should be, they prioritize based on need. We prioritize based on how thick your wallet is. So if you, and then he would tell these stories about, oh, a pregnant woman was left on a stretcher and she wasn't able to get the help that she needed. Okay, studies have shown that 0 people have died due to lack of basic health insurance. So, okay. You know what the number was before Obamacare? 45,000. 45,000 people died in America because they didn't have basic health insurance. So, at the very least, you're doing single payer for humanitarian reasons, for moral reasons, because that is a human being. Okay, it's not a fetus anymore, so it's hard for Republicans to wrap their head around. Oh, it's not a fetus. Well, it needs to work. They need to come out of the vagina fucking with a suit and tie on and be master CEOs. I get Republicans don't understand the concept of, oh, you're not a fetus anymore, so we should actually give a shit about you, which they don't. If you're a fetus, you get more rights. You as a fetus, you would have more of an ability to get basic health insurance than a human being in Republican eyes. This plan demonstrates that 100%. So this is the shittiest bill I've ever seen with my life as watching politics in the last 4.5 years or so. This is the shittiest bill I've ever seen. And if it gets through, your deductibles are going to go up, your payments are going to go up, you're not going to make as much of an income because you're going to pay for health insurance while you were getting subsidized earlier. So I get it. Healthcare is a hard issue to understand. But this isn't the way to go. This is the shittiest bill I've ever seen in my life.